My name is Michael McFall. I'm the director of the Freeman Spogli Institute for International Studies. Welcome back to our Friday at 1 o'clock seminar series that we've been hosting over the last several weeks since COVID. We call it COVID and each week we move around to a different center at FSI to host a discussion. This week, the Europe Center will be in charge. We're going to talk about COVID and Europe. We have a fantastic lineup of people, both local and from afar. And I'm talking a little bit long on purpose because the numbers I see are climbing up. That's great to see. Our moderator today will be Professor Anna Jamal Abusa, who is a professor of political science, senior fellow at the Freeman Spogli Institute, and the director of the Europe Center. Anna, over to you.
Great. Thank you, Mike, and welcome everyone. As Mike mentioned, today we'll be talking about Europe. And the coronavirus pandemic has been a crisis of governance, not just in the United States, but also in Europe. Questions of who assumes responsibility and which level of government making what decisions have been paramount. And so to put the experience in a comparative perspective, we have four fantastic experts to talk to us about how Europe has responded to the pandemic. First up is Scott Greer from the University of Michigan, and an expert on both public health and the European Union. Scott is a professor at the School of Public Health at the University of Michigan, and the author of 4 books and numerous articles on European governance, EU health policy, and territorial politics. Next, we'll have Julie Lynch from the University of Pennsylvania. Julie is an associate professor of political science, and she specializes in European politics and the welfare state, and specifically investment in health policies. She's also an advisor to the World Health Organization and has been very active providing expert advice to numerous organizations during this crisis. Her most recent book, Regimes of Inequality, was published this year. Next up will be Jonathan Roden, who is a professor in the Department of Political Science at Stanford and a senior fellow at the Hoover Institution. He's an expert on federalism and decentralization, and his work focuses on the complex ways in which political representation intersects with demographics. His 4th book is entitled Why Cities Lose and focuses on this very dilemma. And finally, Catherine Stoner is the Deputy Director and Senior Fellow of the Freeman Spogli Institute here at Stanford. She's an expert on Russia and on regional governance, and is currently finishing up a book on Russia's influence in international affairs. So each of our experts will speak for about 10 minutes. Please feel free to ask any questions in the Q&A box, and I will compile those, and we'll take it from there. So Scott, if you wouldn't mind leading us off.
Thank you very much, and thanks for my trip to sunny California. It's a much better climate here. So if I could get the first slide, please. I'm going to start with a story that's on the second slide, which is a little piece of paper that Donald Trump was waving it when he was just discovering the joys of press conferences on the subject of COVID-19. And it's a little world map, and it's a heat map, and it's the kind of map we're accustomed to, where the North Atlantic is in yellow, and Russia's in orange, and Africa is bright red. In this case, it is, back one please, it is what Trump is waving around is a Johns Hopkins comparative analysis of who was prepared for a global pandemic. It came out in January. To their credit, it's still on their website, and it says that the United States is the best prepared country to face a pandemic, with honorable mentions to a couple of others, including Sweden and the United Kingdom. That's not really how the world looks as of May. What did Johns Hopkins, the World Economic Forum, Davos get wrong that led to Donald Trump simultaneously having supposedly the world's best capacity, the Swedes and the British having supposedly the world's best science, and such totally undesirable outcomes? Well, there's obviously striking differences between and within United States and EU responses. In both cases, there's been a really impressive level of weakness by what you would call the federal government. The United States federal government has failed on multiple levels, and we're going to be reading analyses of how that went wrong for the rest of our lives, probably. The European Union, by contrast, just seemed to be missing in action. You had to be a professional European Union watcher for most of January, February, March, April, May so far, in order to even process that there was a European Union and it was frantically attempting to have a role. So why was this? Next slide, please. If we think in terms of comparative federalism, which is not a silly way to think about the EU, first of all, the EU often more resembles the United States than it resembles its own member states. It's got the system of enumerated powers, so it can only do the things that the treaties allow it to do. And much of EU politics, as in any federation, is about precisely fights over what these enumerated powers allow the European Union to do. It's also an extraordinarily complex political system, riddled with veto points, riddled with weird little bodies whose rules can be manipulated. And as a consequence, it has a strong reliance on creativity to get anything done. So just as we have book upon book about the United States and how getting anything achieved in our legislative process depends on unorthodox lawmaking, you also have book upon book about how the European Union requires creativity to accomplish things. Now, you compare the two federal systems. US communicable disease control has a very simple rule. It permits everybody else to underinvest. So states don't have to run epidemiological research stations in Indonesia. They don't even have to run particularly good labs or have particularly good advice. Ditto local governments. But that federal leadership only works when the White House intervenes and knocks heads together. So the US depends on the federal government and the federal government depends on the White House. That's essentially the origin of the failures we're seeing in the US today. By contrast, European citizens do not expect the European Union to save them. They expect their national governments to save them. They instinctively focus on their national governments. European Union powers in the area, which are found under primarily civil protection and public health articles of the treaty, basically allow for win-win solutions. So the basic model of European civil protection is that you have an unexpectedly large forest fire. I have spare firefighting equipment. I will send you some of my spare firefighting equipment. It grew out of international aid effectively. So what they did is they took the model in which Italy can send a search and rescue team to somebody who had an earthquake on the other side of the world. And now Italy is also free to send the search and rescue team to Greece. This is the absolute minimum that the member states could agree in order to solve problems that were win-win or that they couldn't manage on their own. Now, this is for human health. One of the interesting things about the EU is that if COVID-19 were responsible for the mass death of pigs or cows, you'd see a very different and much more forceful creature with powers to do things like order mass culling of animals or close national borders entirely. But once a disease jumps over into human beings, the European Union becomes a very tame creature. Now, the argument in the European Union has been about how much communicable disease control the EU should do. And there's an agency with 300 people in Stockholm, the European Center for Disease Control and Prevention, whose name is an homage to the US CDC, but those 300 people obviously were not intended to compete with the CDC's five-figure roster of employees, because they're just supposed to coordinate data gathering, build capacity, produce publications, gradually nudge member states towards some Europeanized model of understanding diseases and reporting data. What are the advantages that Europeans and Americans see in a strong central capacity? There's a number of them. First of all, by sharing the expenses, you can have much stronger resources. So the CDC is the world resource for all sorts of esoteric diseases, because in the context of the United States, one agency can certainly afford a hantavirus research lab. It produces equity between jurisdictions. One of the things you're seeing in the EU right now is every member state is relying strongly on its own internal capacity for advice. And this, unsurprisingly, is producing inequity if you happen to be a country with 1 or 2 universities and no great tradition of microbiology. It reduces centralization, reduces the effects of destructive competition, so that you're not trying to save money by cutting budgets with individual lines out of them, and doesn't need to be too expensive. And it easily will show its value when something goes wrong. The disadvantage, I put Donald Trump, the disadvantage is that building any kind of capacity, as the Johns Hopkins model shows you, only works if the capacity is then well used in an actual crisis. And the question is, what would EU misuse of a capacity look like? Probably inaction. Next slide, please. Next slide, please. So this is a standard trick in EU health policy circles. This is the public health article. The EU depends on exercise of enumerated powers that are listed. And here we have what Article 168 allows the European Union to do in public health. It is a lexicon of how you make sure the European Union isn't going to push member states around. It gives the lie to the Brexiteer myth that the European Union inexorably expands its powers. simply because the member states wrote language that means the EU can encourage cooperation and complement member states and coordinate amongst themselves in liaison with the Commission. They deliberately wrote an article that would mean that, justified by public health, the European Union would do very little. It would act in other areas. Next slide, please. So what now? Will the European Union perceive advantages to coordinating? Now, Jean Monnet famously said that Europe will be forged in crises and will be the sum of the solutions adopted for those crises. And it's the standard theory of how anything in the EU develops, that it goes through crises. Now, a more subtle version of that is that Jones, Kellerman, and Meunier argued that the EU fails forward, that they produce a lowest common denominator deal between states with diverse preferences and shared problems, which then fails to manage the broader underlying issue, even if it addresses the short-term thing that led them to do something. And so they agree on a new one. And you can see this in financial regulation, their case. But you can also see recurrently crises that force member states to recognize that their level of integration demands some kind of joint EU action. They then do the worst possible version of EU action because their preferences are diverse and they're often skeptical of the European Commission in particular, gets them over the hurdle into something else. Now, the member states might decide that as they attempt to reopen in particular, that they need more European coordination, because just as we have no idea what to do when some American states are buzzing with disease and others aren't, we also don't have a particularly good idea how to run a continent where 6 or 8% of GDP depends on tourism if everybody's afraid to travel, let alone strawberry pickers from Romania showing up in Western Europe. There's a lot of reasons why mobility of people is already built into the European Union. And in the absence of good therapeutics or a vaccine, we're going to have to manage regional lockdowns, individual data, and that's going to depend on a level of trust in your neighbor's data and your neighbor's public health mechanisms that currently does not exist. It was not desired by member states. It is still not desired by member states, but there's a strong chance that they're going to have to go in for it and improve European data collection and European resources simply because that's the best way to get themselves to a situation where they actually trust their neighbors. So the place to look for EU public health action is primarily going to be in things like improved data collection, standardization, and pushing member states to be able to say with confidence that they do or do not have an outbreak and they are or are not managing it. Thank you.
Thank you very much, Scott. Julie, would you like to go next?
Okay, so I'm going to try in 10 minutes to talk about the country level responses to COVID-19 in European countries, primarily in Western Europe. I'm going to first kind of outline very quickly what the policy response has been and take a few cracks at maybe why that policy response has varied across countries. Then I'm going to show you a little bit about the health outcomes that have been occurring as a result of the pandemic in different countries. And then I'm going to see if we can kind of try to connect those two. And as you'll see, I'm a little bit skeptical at this point. Okay, so what has the policy response been? So the first thing I want to say is that the policy response to COVID-19 that we first think about is usually social distancing and sort of restrictions on public events and mobility. But I think it's really important to recognize that the policy response to COVID-19 in Europe, just as it is here, is actually much broader than that. So I want to think about the policy response in 4 areas. So the first is this sort of familiar restrictions on social life. Secondly, we need to think about what governments have been doing differently in terms of testing and contact tracing, which is really critical to controlling the spread of the disease. Thirdly, there's a response that takes place in the medical care system that's worth paying attention to. And fourthly, there's a series of economic interventions aimed at both individuals and firms that are trying to kind of keep the economy afloat. And all 4 of these things are really important to understanding how the pandemic plays out. I have a lot of slides and I'm going to go through them really, really quickly. I don't need you to look at most of the slides, but they're there, and so if you need them, I can go back to them. But don't be concerned at the number of slides. Okay, so I'm gathering the data here on the policy response from 2 main sources: the Oxford COVID-19 Government Response Tracker, the CGRT, and the European Observatory on Health Systems and Policies, which has a COVID-19 health system response monitor. These are both really beautiful sources of data, and I highly recommend them. Okay, so first area we want to look at is social restrictions. And really the main thing that I want to say about social restrictions, this is the government stringency index from that Oxford data set. And basically what you can see is that there's variation over time and across place within Europe. But by late March, there are really only two real outliers. Sweden and the UK seem to be doing things that are a little bit different from what other countries are going through. And by the very end of March, the UK had started to update some of their social restrictions as well. So by the very end of March, we can see a continent that's really quite restricted in terms of social gatherings, mobility, et cetera, with the notable exception of Sweden. What's happening in terms of testing? The graph on the left simply shows how little testing is being done anywhere in Europe compared to East Asia and the Antipodean countries. But there's still substantial variation across countries in how much testing is going on. And part of this has to do with what the testing policies are. That's on the right-hand panel. The peach countries that make up most of the Western Europe are testing people who have symptoms and key groups of people, usually medical providers. The countries in teal are testing anyone with symptoms, and the countries that are in blue, which are interesting to pay attention to, we're looking at Poland and Iceland, and I'm gonna discount the data to the east and let Catherine say something about who's actually being tested there. But in the Western European countries, it's really, sorry, did I say Portugal? Poland, I meant Portugal. Portugal and Iceland are the two countries in Western Europe that are really testing extensively, and they're gonna come back. Contact tracing, kind of similar story. A lot of variation. You're starting to see the contact tracing being rolled back now, sort of in the right-hand panel. We're seeing that both, we're seeing rollbacks in the extent of contact tracing, both in places like Germany and in places like the UK. It's worth noting as a sort of interesting feature of the data that Germany and the UK are probably rolling back contact tracing for different reasons. It's happening in Germany because they feel like they have the pandemic under control. It's happening in the UK because they don't have it under control and there are simply way too many contacts to trace. So as we think about using these data for future analyses, I think it's really important to keep an eye on these kinds of subtle differences. All right. Medical care provision and access, there are lots of different ways that this takes place. Essentially, European governments made changes to how they fund their healthcare systems, made changes in how people have access to their healthcare systems, made changes in how the healthcare systems actually work and treat different kinds of cases. There's a lot of variation across countries in how this occurs, including in terms of what pre-existing resources there were and the character, magnitude, timing, and duration of the interventions. We still don't really have a firm grip on what the cross-national variation looks like here, except to say that there's a lot of it. Finally, in the area of economic intervention, similarly, there are lots of different kinds of interventions. There are supports to individuals, including, cash transfers and extensions to unemployment benefits, things of that nature. Also supports to firms, wage insurance policies, lifting of obligations to pay social insurance contributions, et cetera, and also direct interventions through public employment. Again, a huge amount of variation in how this stuff is happening, which hasn't been thoroughly worked through. I'm happy to tell you that Claire Bambra at University of Newcastle and I are making our way through all of these data, and we will soon have something very intelligent to say about the variation. However, the big question is, why does the policy response vary? And I think, our best preliminary answer is that if you think about what's happening in both the healthcare system changes and the economic policy response, it's pretty easy to see that kind of pre-COVID-19 political economy, welfare, and health system models explain a fair amount of that variation as best we can tell. What is not explained so well is the social restrictions and the testing and tracing. And so that's where there's a lot of surprise, people looking at the policy response and saying, hey, this doesn't look like we expect it to look. I think if we knew more about pre-existing public health regimes, we would see that there are not quite as many surprises as we might think. But research in this area is really severely underdeveloped, especially compared to research on comparative social policy and comparative health policy. So that, I think, should be a priority area for future research. And Scott, you know, we have this book that we still have to write on that. We also should, I think, be looking to more contingent political factors, including the partisan composition of government, to understand, you know, some of these shorter term interventions that aren't so governed by prior political economic arrangements. And obviously we should be looking at interactions among these things. So for example, if you have a conservative-led government in Sweden, it's going to interact with a big generous welfare state, but you're going to see different kinds of parameters developing. Okay, how's the pandemic doing? Got a lot of excess deaths. So right now, excess deaths are the only decent source of data. They're the only source of data that you should believe on how the pandemic is proceeding, because deaths are measured and incidence of the disease are measured so differently across countries that it's really impossible to compare right now what's happening through anything other than looking at excess deaths. Excess deaths are the number of deaths that are being experienced, usually measured on a weekly basis, that are in excess of what you would normally see at that same time of year in that same place. And so here you can see a map of the excess deaths. And the main thing that I want you to take away from this is simply that, you know, by early April, lots of countries in Europe are experiencing excess deaths and heavy excess deaths. Those are the darkest blue. These data are from the European Mortality Monitoring Exercise, which is also an excellent outfit whose data I trust very much. I'm going to show you a little bit of detail here just to make it easier to see what some of the variation looks like. So if we look at the UK and Ireland, the height of that bump over to the right is the standardized amount of excess death in each of these places. And what we can see is that if we look at differences across the UK and Ireland, it's really England that's experiencing a very high and sustained level of excess deaths. Similarly, the Nordic countries are doing pretty well, except for Sweden. Sweden is a big outlier. Southern Europe, Spain, France, and Italy doing poorly, as you would know if you're reading the news, but Portugal and Greece have experienced very little excess deaths. So what is going on there? Germany and Austria seem to be doing pretty well, but Belgium and the Netherlands experiencing a lot of excess death. If we look at those high mortality countries, I just want you to get a sense of what's the magnitude relative to each other. We're hearing a lot about Sweden, which is the bottom graph there. And yes, it's true that Sweden is doing much worse than the other Nordic countries, but compare it to England and it sure looks a heck of a lot better than England. So I think it's worth keeping some of these comparisons in mind too. Okay. Is there a connection between the policy response and the excess deaths? This is what we all want to know, and this is what comparative, public policy researchers are going to be studying for the next 20 years. So from what I can tell so far is if you look at any given point in time, the social restrictions index, which is what most people are thinking about, is not highly correlated with excess deaths, even though there's some really juicy, tempting outliers that might make us think that they are, namely the UK and Sweden, which have been less restrictive and have experienced greater than expected excess deaths. Secondly, I think there is probably a case to be made that early testing may be related to less excess mortality. Portugal and Germany seem to be examples of this, and I think as we dig into the data, we may find that early testing really, really matters. Finally, when it comes to medical care interventions and the economic interventions, I think it's really too early to know. So I'm going to end with a slide that talks about some lingering inferential issues. So why should we be cautious about making connections between the policy response and the mortality outcomes that I showed you? So one reason is that we don't know what the right lag structure is. In other words, we don't really know how long it should take these policy interventions to produce an influence on mortality. For the social restrictions, 14 days seems like it might be the right lag, but for some of these others, we really don't know. Secondly, I think it's a mistake to view all countries in Europe as having been equally exposed to the treatment of the pandemic. We can't think about this as a quasi-experimental situation. Countries have been exposed to the pandemic in different ways and to different extents, and also, of course, at different times. Thirdly, I think we need to be really careful about thinking about intervening variables. So certainly when it comes to the social distancing stuff, the behavioral response to government restrictions may actually look quite different on the ground from what the restrictions look like in practice. So for example, there's cell phone data that shows that Swedes on average are not being a lot more socially mobile than Germans, even though the German restrictions were somewhat more stringent than in Sweden. And finally, I suspect that there are many elements of the pre-COVID-19 context that probably influence both the policies that were made and the health outcomes. So things like how much austerity there was prior to the crisis, what the organizational culture within public health looks like, and how easily public health experts communicate with central government officials. And the levels of trust in government, which may help to determine things like the behavioral response. So I think there's a lot that we don't know about the connection between policies and outputs. And I think, you know, we have to be really careful about telling stories when we don't know what those stories really are. That said, I know the story that's probably on most people's mind is Sweden. And I am willing to take a crack at Sweden in the Q&A.
All right, what I'd like to talk about is making a broad comparison between ways in which the Europe and the United States appear to be different. For people who know me, it's not surprising that I would want to make some maps and talk a little bit about political geography. So that's what I'm going to do here. And I want to talk about the geography of the virus as well as the underlying political geography, and see if that helps us understand some broad differences in the way that things have happened in different countries. The question I am going to try to answer, or at least introduce, is why is the pandemic so partisan in the United States? Why has it become wrapped up in into a political, the polarization between two parties? I don't think I need to go into too much detail about this. I think people who've been paying attention have probably seen some of these studies suggesting that from the beginning in the United States, we've seen strong partisan differences in survey response between people's level of concern about the virus, about support for various mitigation policies and behavior. So all of the data on mobility from cell phones suggests a robust partisan difference, even when we control for a lot of things. In Europe, this is something that, I don't have nearly the same kind of data, and perhaps this is wrong, and I'd love it if people would try to correct me on this. My sense is that there's been a lot of partisan bickering over the quality of the response. So, in a place like Spain, this is a good issue for the Partido Popular to use against the socialists. In kind of complaining that the response was insufficiently strong, or wasn't as effective as it should have been. And I think there's also a similar, there's less enthusiasm for shutdowns, just as in the United States, in places where the virus has been, where the spread has been limited. That's something that we see everywhere. And I think pro-business interest groups and parties have tried to lobby to relax the shutdowns earlier. That's kind of common. And the kind of really extreme rhetoric about the virus being a hoax is something that we see maybe on the fringes of the far right, like the AfD in Germany. But it seems to me that we don't see, I can't think of a European country in which this deep polarization about whether the virus is something that is serious or not, whether it's something that should, whether government has a role to play in combating the virus. The kind of fights that we're having between the parties in the United States about mitigation, it's something I don't think we've seen on the same scale in Europe. And so that's kind of the question that I'm trying to understand, is why this difference. One possibility I want to lay out is that there's been something kind of unique in the United States about the intersection of the geography of the virus and partisan geographic polarization that, of course, preceded the virus, and the way this overlays with the nature of federalism and decentralization. So this is a graph of, this is just from yesterday's data, county level graph in the United States of, on the y-axis, on the vertical axis, we have COVID-19 deaths per 100,000 people. And on the horizontal axis is the log of population density of the county. And so you can see that there is a very strong correlation between population density and the emergence of the virus. The biggest, and the sizes of these data markers are the size of the population, just to give you a sense of that. So obviously the virus emerged in places like New York City, and the cases and the deaths are overwhelmingly, really dominated by New York, but also we saw the outbreak in New York, and in New Orleans and Wayne County, Detroit, and a few other places like that. And that really kind of shaped everyone's understanding from the very beginning of the virus. It really emerged in the United States as an urban problem. Just to give you the latest, so that was just total, that was the total deaths up until May 14th. What you might be interested in knowing is what has happened just in the last week, like what's the most recent. So this is really changing, and you've probably read some things about this in the newspaper. The virus has spread in the United States from the urban core to the suburbs, and now starting to move to rural areas. So these are COVID deaths per 100,000 since May 6th, so just basically in the last week. And you can see it's actually shifted to rural places. And so a lot of the new outbreak now is not in the urban core, but it's in rural places. But I want to just highlight that if you take a look at these counties and you figure out what's going on in these places, most of these have a federal prison or a state prison. They have a meatpacking plant of some kind. And for the remainders, the vast majority of the deaths are in nursing homes. So just kind of keep that in mind as we go forward. But so anybody who's read my work on this kind of thing knows this is kind of where I'm going. The correlation between population density and voting in the United States is just incredibly high. This is something that is we see this correlation in most places, but it's much stronger. It's really quite pronounced in the United States, and this correlation's been increasing ever since the New Deal. It's been especially increasing since the Reagan administration. So partisanship and population density are basically the same thing in the United States. This is an overwhelming cleavage on which our party system is based. So you put that together with the urban incidence of the virus, and then you get something like this, that the correlation between the Democratic vote share and COVID deaths per 100,000 citizens is also a very strong correlation. Again, this is shifting. So now in the last week, it's shifting to more Republican places, but still, the overall relationship looks like this. And so I think a better way to look at this is just taking the cumulative share of deaths divided by different kinds of counties according to their partisanship. So this is from the very beginning, starting in March and then going up to until yesterday. And so what you can see here in the blue line is that at the beginning, the deaths were overwhelmingly occurring in places where the Democratic vote share was above 60%. So this is Seattle, New York, and Detroit, and New Orleans, and so forth. But over time, of course, that has fallen, and the cumulative share of deaths in more competitive places between 40 and 60%, many of these are more suburban kinds of areas, that has really increased and then sort of leveled off. But then the places that are very Republican, which are mainly rural places, have been pretty low and pretty flat. There's not really a very big increase there. So it's just pretty striking how partisan has been how the geography of the virus has been correlated with partisanship. And I think that has created a situation in which from the very beginning, the Republican Party is essentially a rural and ex-urban coalition, and a public health crisis emerged in cities. And the reaction of of essentially a rural coalition to an urban public health crisis was to let the state and municipal officials deal with it. So we ended up with this sort of a decentralized patchwork response that has kind of come to characterize the U.S. So I want to see how this looks in Europe, because I think Americans have we've got accustomed to this idea that virus and density go together, and it's really all about density. And on some level, there's truth to that. But when we start looking around the world, it's much more complicated. So here's just some data I put together from the Kreis level, the county level in Germany. And you can see that the cases per capita and deaths per capita are really concentrated in Bavaria and Baden-Württemberg in the south of the country. The breakout in Germany came from people returning from ski trips in particular locations. And you can see that in the east and in much of the northern part of the country, there still hasn't been very much viral spread. And you can probably also see, anybody who knows Bavaria knows that these are not densely populated places. And so the correlation between density and deaths per 100,000 is actually negative in Germany. And there's really not a very strong correlation at all, but to the extent there is, there have been more deaths in more rural places. Now, rural Germany, anybody who's spent time in rural Germany, it's much more dense. So people live in much more dense conditions than they do in the rural United States. And that's true throughout Europe. I mean, small town Europe is in some settings is relatively dense. And the same thing was true in parts of Italy. But Germany also does have a correlation between density and voting. This is not unknown to Germany. And so we can see here, there is a correlation between density and the left vote share. Here I'm adding the SPD, the Greens, and the Left Party. Not quite as strong as in the United States, but there's certainly a relationship there. But in Germany, because the virus really emerged in Bavaria and Baden-Württemberg, places that are really where the union parties, the Christian Democrats and the Christian Social Union, are strong. We see that the deaths are really are concentrated in places where the left was less successful. And so I think it's important to note that we had a grand coalition of the SPD and the Christian Democrats at the federal level. And in some ways, this might have been a fortuitous thing. This is really quite different than the United States, where we essentially have a rural coalition at the federal level with the emergence of an almost exclusively urban public health crisis. Whereas in Germany, you have a crisis that is much more diffuse. It's not really concentrated to the extent that it's concentrated, it's in the largest party in the governing coalition. In their base is where the virus emerges. But we have a grand coalition between these two major parties. So the whole idea of blame shifting and all of the kind of desire to kind of shift the blame and the responsibility onto lower levels of government really didn't emerge in the same way in Germany. And all the parties are represented in all the various Land governments, the state level governments anyway. And so it's a really very different political dynamic. I want to move on quickly and get to Catherine. But also just looking at Italian provinces, and I'd like to put together some data from some additional countries. I mean, I think we need to get the only data that to me are very useful are at low levels of aggregation. Even the US counties to me are really too big. I'd like to get tract level data and really explore the question of population density that way. But at the province level, which is the best I could do so far in Italy, again, there's no real correlation. I mean, if anything, it's kind of medium density places. The virus in Europe, by and large, with the exception of Madrid is an exception. Even within Catalonia, Barcelona was not really the worst hit places. It was smaller towns in Catalonia. This American concept of concentrated deaths in the urban core is probably driven a bit more by the concentration of poverty in the urban core in U.S. cities, and we just don't see that in Europe. Until really, it's not the case that the virus was concentrated in particular big cities in Italy either. And so it doesn't, it's concentrated in the north, I think, as everyone knows. And of course, Italy does have an interesting kind of political division recently. It's interesting to note that in the place where the virus was really was emerged most strongly are the places where the center left and the center right are really competing. And so at the moment of the emergence of the crisis, there is a coalition between Five Star and the center left, But the center right, of course, these parties, especially Salvini's party, is controlling the regional governments in places like Lombardia and Veneto. And so I think, again, you don't have the same kind of stark divide and the same incentives for blame shifting. Maybe you have a little bit of that in Italy. I'd like to hear more from people who know more about it. Maybe Julie has some thoughts on this. But if anything, it's the kind of the quality of the response in Veneto has raised the political prospects of the president of Veneto, who is now perhaps in a position to challenge Salvini on the right, who he's trying to play this kind of anti-immigrant and anti-EU card, and also trying to claim that the shutdown has gone too far. And it seems like that is not, that's not been a winning strategy for him. So I think these kinds of factors, of course, they vary from one country to another. These are just a couple. I'd love to talk more about Spain as well. But I want to leave you with this thought here that that we just didn't see the virus emerge in a way that mapped almost perfectly onto a strong partisan divide in Europe. That's just not the way it emerged, and in part because they just, in multi-party systems with kind of complex coalition dynamics, you just don't have anything like the American two-party polarized divide. And so in the US, it's the case that the virus kind of really kind of crashed into an existing divide of this kind. It's really, I think, a big part of the story for why the US has looked so different from Europe in the nature of its response, and the reason why it's been so partisan, why it's so difficult for the U.S. to come up with a strategy to move forward. I think I will stop there.
Great, thank you very much, Jonathan. And since we've talked about polarized democracies and multi-party democracies, it's time to talk about non-democracies. So Catherine, if you can talk about Russia, please.
Yep, you can hear me and see my screen. Great. Okay, so right, it leaves me to talk about Russia, and I'll try and do it relatively quickly because I think there are a few key questions and a few key parallels between the previous cases and between Russia. Although in some ways Russia is, as can be the case, off on its own. So just starting with a quick picture of Mr. Putin picking up the handling Russia's response in March to coronavirus. There he is shaking hands with the head doctor of one of the main, at that time, main hospital, handling coronavirus patients. Notice not only is there no mask on either of them, no protective gear whatsoever. So it started out with a bit of a cavalier response. Russia had relatively low rates. As we'll see, things change. Oh shoot, now why are my, okay, here we go. All right, so I thought it would be useful to just take a quick look here at how Russia compares to other countries. You may have seen in the New York Times or elsewhere that the rankings every day, and Russia is number 2. So in a way, it's a coronavirus superpower, I suppose, as regaining great power status that way. But as you can see, it's a very, very distant number 2 to the United States in terms of total cases. Share of the population is 1 in 573. That's also pretty low comparatively. But if you look in its neighborhood back into Europe, the actual total number of cases is not terribly different. It's the, I'd say, share of population not terribly different from Turkey, which is not far away, obviously. It's the death rate that is what I think intrigues people. Why is Russia's death rate comparatively low, so low relative to others? And so the typical answer, if we were live, I would ask you, and you would all say, oh, well, they're underreporting, they're lying, that Putin, he's an evil genius, and here he goes again. Well, that's undoubtedly partially correct. There's probably inaccurate reporting, putting it kindly. But one of the real reasons is the way that it is reported, and what is counted as a COVID-caused death is different in different countries. So as it turns out, Russia is one of the more conservative places, and the health ministry directive is that, I'll read it to you, in the absence of clinical manifestations and pathological changes, sounds better in Russian, especially in the lungs. So it is not COVID counted unless it is clear that that is the only cause of death. So that's different than elsewhere. So if you had leukemia or any other form of cancer and you got COVID, you wouldn't necessarily in Russia be counted as dying of the COVID. You'd be dying of your underlying disease by the way that they classify deaths. So that partially accounts for the differences. In a second, I'll show you, give you a little tour of the world around Russia and see how it compares. So that's part of it. If we counted mortality in the same way, for example, that we do in the US, and this has been calculated by a couple of different people, you would have about 233% more cases, death cases, than Russia is reporting. So it would be closer to the German rate or Iran, that is about 7,000 dead as opposed to 2,305 that are reported up there. And that'd give you closer to a 2 to 3% death rate rather than what Russia's reported of 0.09. So it's not all corruption, but that could be part of it. In a second, I'll explain Russian federalism and the incentives to underreport are certainly great. But it's also the style of reporting. The other thing is that they will apparently change this in the next few weeks. And some regions have struck out on their own and changed the way they report it to make it seem more in line with the rest of the world. So it's not just, as is so often the case in Russia, it's not always what you think it is or what you assume it is. So this just gives you a sense from early March through May of the neighborhood and how things are going. And Julie had mentioned I'm gonna try and just get rid of this so I can, there we go. Julie had mentioned that I would show you this quickly, so I will. There's this intriguing pattern you may see. The farther east you go, the lower seems mortality. Not entirely sure why that's the case. The virus came a little bit later to Eastern Europe, but look at this, Kazakhstan. This is case fatality rate is low. Here's Russia, and as I mentioned, 0.9% would be the mortality rate, the way they're counting. I think it's safe to say in Central Asia, they're using the same form of counting. And then as we start going west, you can see the numbers going up higher. Again, coming later than other parts of the world, but Hungary particularly high. Okay, so here we are looking a little more deeply into Russia. Jonathan had talked about population density, and I'm going to talk about that in a moment as well. That's undoubtedly another reason why we see perhaps some variation in incentives of reporting. But the number of coronavirus cases in Russia really started to kick up here at the second week of April, and have gotten up to about the 253,000 number as of today. What's intriguing is the new cases that are reported is relatively flat, but it's about 10,000 a day right now. So they're not on a good trajectory unless they do something radically different. The initial state response was, as noted here, this non-working period. People were first given a week of paid vacation, and that's when we saw the most of President Putin giving some good news, as in you can all go on vacation, don't come back. It happened to be around the Orthodox Easter period, so people liked that, and that was important to him. Regions start going into lockdown at about this period. Putin goes into a sort of lockdown himself in that he goes out to his country home just outside Moscow and seems to stay there and begins to pass the responsibility of handling the coronavirus down. And this is where we also bring up the theme of federalism, just as it's been raised in some of the other countries. So this is just a quick map. Russia is the largest country in the world territorially, and it has lots of external borders, 14, highest number of external borders. So you would think that would mean, especially since we have a big border out here with China, that you would see more cases here in the far east of Russia. We don't really. Most of the cases that have been reported are concentrated in Moscow. Moscow is a city of about 9 million people, so that is really where everything is focused. We have a few little random places like Dagestan, Murmansk that have kind of idiosyncratically high cases, which I can talk about later if anybody happens to be interested. Why is it disproportionately in Moscow? Jonathan talked about population density may or may not make a difference. I think that's probably what does make the difference here in Moscow, and also some not terrific initially, as that first picture that I showed you of Putin shaking hands with the doctor at the end of March in the COVID hospital. Some not good quarantine practices initially, but then picking up better practices as time goes on. There's a huge variation in Russia in wealth and capacity to deal with the virus. So Moscow, I was listening in on a talk yesterday at Columbia where she pointed out that the speaker pointed out that the regional gross regional product in Moscow is roughly equal to Qatar's, whereas in Dagestan it's equal to the Gambia's. So this is tremendous variation in capacity, and there's no means testing in most government response at this point. So Moscow will get as much as Dagestan. What is the state response? Well, as I said, Russia's a huge country. Technically, it's federal, but it has functioned more unitary in practice as of late. Mr. Putin, after that rather spectacular opening of visiting the hospital, I'll show you another shot of that in a second, devolved authority over COVID to Russia's regions. There are about 89 of those. Sometimes they merge, they go apart, they come back together. He appointed the very capable mayor of Moscow, Sobyanin, the head of the COVID task force. And so he's gotten to deliver all the bad news so far, not Putin himself. Putin delivered the good news this week on Monday of opening the country, coming out of a pretty strict, in many places, shelter in place, where you could only go 100 meters from your apartment building to walk your dog in downtown Moscow, for example. And regional governors have been tasked with basically managing their own region's response. So we're getting kind of a competition for PPE and that sort of thing. But Moscow, you saw the disproportionate numbers there. That is really where the virus is hitting the hardest. Putin has not been appearing day to day, except starting to come out of his little cave this week. His first national address is March 27th. He just started, as I said, to look more in charge. He's actually in the Zoom meetings that have been shown, he looks kind of bored and a little restless. Although he's got a great gym out there. I'm sure he's fine, everyone. There was some suspicion that he might have COVID, especially after that handshake that I opened with. He doesn't, but the Prime Minister of Russia, whose name I bet nobody knows, but a few of us here, Mishustin, he is actually infected with corona, as so is Dmitry Peskov, who is Putin's spokesman, longtime spokesman, and 3 other members of the Russian cabinet. So it's hit pretty close to him, but we don't think it's hit him yet, and probably won't, given where he is. There has been financial relief from the federal level, but it's been kind of selective, and it coincidentally has been hitting people who are more likely to be pro-regime than anti-regime. So state and public sector workers are getting the most help if they are losing their jobs or in danger of losing their jobs. They'll get paid until the end of 2020. Some very, just because Anna's here on the line, sort of populist policies, I think, in terms of trying to take care of people financially and anticipate some of the economic issues. Banks are giving repayment vacations on loans and mortgages. higher taxes for money sent out of the country, families with small children. Medium and small businesses, though, are not getting as much help. So here he is getting a little more serious with the state response. And I don't know if we'll see Donald Trump put on a full hazmat suit, but this is Vladimir Putin trying to encourage people, impress upon them how serious the virus is, but then leaves shaking hand with the doctor who brought him in. Socioeconomic effects. So in a Levada poll, which is the reliable polling, about 44% of the population say life has not changed for them this week, or 44% of those polled, I should say. 21% able to work from home mainly, 15% unpaid, 1% fired, so that's pretty low. 4% have gone to part-time work, and 8% are on some sort of paid leave or forced vacation time. 70% of Russian families have no more than 6 weeks of savings. That's probably pretty similar to the United States. 735,000 have registered as unemployed. A third of the economy stopped. They may get up to about 10% unemployment by the end of this year, maybe more. Real wages are most problematic because they are going down another 5%. And over the last 7 years or so, this has been a problem, even though the economy's come in and out of recession. Before this started, it had really modest growth of maybe 2-3%. But real wages were going down, and they're going to go down further. So Putin actually really depends on a certain segment of the population, and he's particularly dependent on them right now because the context has been him trying to get a referendum through that will enable him to stay in power for another 12 years beyond when this term ends. So he would stay in power until 2036 potentially, if this referendum on constitutional changes went through. So this could be why they opened up the country. It was really popular. He announced it personally. 80% of people are in favor of getting the country rolling again. And it may also explain why he didn't take sole charge of the COVID response, which is getting sort of a tepid national embrace. And his approval has been going down. So governors are getting better ratings than federal authorities, including Putin, on handling COVID, probably because people see them out and about and doing things that they're not seeing him do that until very recently.
Thank you very much. We're almost out of time. There are sort of two sets of questions that kept coming up. So if you take a minute to answer. The first one, and Sweden, and why, what are the projections for the Swedish trajectory? The second question is for you, Catherine, which is about, so if a very brief discussion of Sweden and then the change in the Russian.
Okay, I'll say something about Sweden. I can't project what's going to happen in Sweden. I really don't know, but I can tell you what I think happened. So I think the big question that people have is, did the relatively loose social distancing policies in Sweden lead to the higher excess death rates? And I think the answer to that is yes and no. So the government justified its looser policies by saying that it trusted its population to do what was recommended, but didn't need to tell them, didn't need to make rules. And on average, it seems that from cell phone data, it seems that the population did comply. The excess deaths that Sweden experienced have been mainly in nursing homes. And so the question is, like, what's the common thread here? The common thread, I think, is that there was a group of people in Sweden who didn't really comply, from what we can tell, and who experienced much higher incidence of the disease, and that is non-ethnic Swedes. So racial and ethnic minorities in Sweden have been much harder hit by the disease. They also are much more likely to work in nursing homes. So I think that the answer to the Swedish puzzle may in fact be that it's a failure of social and economic integration of racial and ethnic minorities, rather than the loose policies per se that have created the higher death rates in Sweden.
Right. Catherine, you have 30 seconds.
Unmute. Okay, hopefully you can hear me. So it's actually not just Russia that does this. Other countries do it too. I guess, you know, I don't know enough about medical statistics and how they're reported, but Russia also has a much higher rate, for example, of doing autopsies than the rest of Europe. So I think it's Belgium that has a very, very liberal way of counting coronavirus cases, and Russia's on the more conservative end of counting them. They are allegedly going to bring the way they've done it into alignment with European or more international standards, and so we may see the mortality rate go up there. But it's still, I think, you know, population density is partially what's driving things down. But I think it's not just Russia that does this; other places do it too.
Wonderful, wonderful. Thank you, and to all of you for joining the conversation. Mike, do you want to have us say a final? No? Great, wonderful. In that case, thank you very much, and stay safe.